In Health Watch, a new investigation found sheriffs in Alabama are releasing sick inmates to avoid paying their medical costs. This is according to ProPublica. Inmates in need of emergency medical services are being released on a medical bond. This frees the prison system from being responsible for the medical bill, but in some cases, those inmates are then rearrested once they're released from the hospital. Connor Sheets is the investigative reporter behind this piece and joins me now from Birmingham, Alabama. So this is really interesting because, when you think about being in custody, it means often that the municipality, the state, the city, whatever, is responsible for your basic needs, 3 hots and a cot, and your welfare. They have to care for you in terms of health. So to hear that there's an option to sort of have like a medical reprieve is sort of stunning to me. What sort of illnesses or health issues are falling into this category?
So, hi, it's great to be on here. I just wanted to, there's a whole range of different illnesses that can fall under this. Really, there's no limit. In my story, we talked to people who had gone into a diabetic coma. One guy who had a severe heart attack, and then there was even a woman who died because of illness that she was experiencing. She actually had a severe stroke, and she wasn't taken to the hospital in time because of issues where the sheriff's office was trying to determine whether she should be bonded out or if she had insurance or what was going on with her. So runs the gamut.
So then explain the process of getting the patient to the hospital and what these patients go through on their way there.
So essentially, I mean, as far as getting to the hospital, we didn't really look too much at that. But before they actually go to the hospital, we were looking at, for instance, the first person in my story, his name is Michael Tidwell. He was booked into a jail in 2013 in Alabama. Within 6 or 7 days, his diabetes had flared up really badly. His blood sugar was like 15 times beyond what it was supposed to be, and they needed to take him to the hospital, clearly, but rather than having to pay for his medical bills, they found a way to do what's called bonding him out, which is they actually propped up his slumping body and had him sign a document saying that he was being released. And because of that, the jail and the county were not responsible for his medical bills. And some of the other inmates we talked to, or people we talked to who were familiar with their cases, actually ended up getting stuck with those bills, tens of thousands of dollars worth of bills that they were responsible for paying for, even though the medical problems they had came up while they were in jail.
So what factors are these sheriffs considering when they determine that they're going to pursue a medical bond? I mean, are they finding out whether people have private insurance or not, or what is it?
Right. So we did 2 articles. The second one we did included an audio clip of sheriff's office employees in a small county in Alabama actually discussing what to do with an inmate. This is the woman who ended up dying, young, in her 30s. She ended up having a stroke, and they were discussing, she's throwing up, has her blood pressure is way out of control. What should we do? Does she have Medicaid? Is she on private insurance? And should we find a way to get her out of here in a way that we won't have to pay for? So, I mean, those are the types of things that they're actively talking about openly in these sheriff's offices.
So then how does it work? If you're in custody and you have a medical emergency, and say you are on Medicaid or you have private insurance, and you're treated within the I guess, the prison system, does your insurance pick up the tab for that, or that's all supposed to be kind of something that is included in your custody?
Right. So, I mean, just to be clear, this is county jails that we looked at. We think that it might be also happening in some state prison situations, but these are unconvicted, accused criminals, not people who have been convicted of crimes. But essentially, most of these people do not have. I didn't talk to anyone who had private insurance while they were in there. A large percentage of incarcerated people do not have insurance. Medicaid does not. Basically, Medicaid and Medicare do not cover you while you're incarcerated. So, you're at the mercy of these sheriff's offices to take care of your health. A lot of sheriff's offices provide various healthcare options provide healthcare within the facility. But in these cases, in multiple counties that we talk to sheriffs of, they just don't provide any healthcare whatsoever. No nurses, no doctors on staff or visiting at any time. So really, there's not that many options for these people.
So let's talk a little bit about that, because your piece does focus on the lack of medical staff and medical training for the jail staff. Why is there no money being provided for these prison systems in Alabama when it comes to health care?
Yeah, so again, I mean, these are county jails. County jails are funded entirely, through county budgets. I think they might get a little bit of state money or whatever, but really the funding is coming from the taxpayers in those counties. And these are some of the poorest counties in America, some of them. I mean, we were talking to the Butler County Sheriff. I mean, he just openly said, we can't afford to pay for any of this stuff. They have about 20,000 people, a large percentage of whom are at, below the poverty line. So really, they just have very few resources. And so some advocates have argued, if you don't have the resources to pay for people's health care, and they're clearly not a danger to society to any high degree since you're releasing them eventually anyways, some advocates have said, why are they even being incarcerated in the first place? The question is, if you can't afford to pay for their health care, is it right to be incarcerating them at all?
Right. I don't know if in your piece, in any of the pieces that you did, if you actually spoke to people from these hospitals, because they know, obviously, these kind of formerly incarcerated people are getting stuck with the bill. But if they don't have the money, ultimately, it's the hospitals that are getting stuck with the bill. And so that's what they're doing. They're offloading the costs onto the hospitals.
Yeah, and that has happened in some occasions. I've tried to speak with some of the hospitals. I mean, they're very reticent to talk about these cases because of, laws about, HIPAA law and medical records law. But I mean, the impression from health experts that I talked to is that, yeah, this is just another thing burdening hospitals, and then that gets passed on to the people in those communities in higher rates and stuff anyways. So someone's paying for it.
Yeah, exactly. Well, great reporting, Connor Sheets. Thank you very much.
Thank you so much. Thanks for having me.
So you can learn more by watching our CBSN Originals documentary, The Perils of Private Prison Healthcare, at cbsnews.com/prison.